China finds itself ambushed by an eruption of the extremely troubling new Omicron offshoot JN1, which officials gravely warn could hasten a nightmarish viral resurgence across the nation right as it strives to heal from recent ubiquitous waves. According to notably distressed health authorities, the vicious JN1 variant alarmingly already accounts for a staggering 30% of all circulating COVID-19 strains as of December, a frighteningly meteoric 26% explosion since November. Multiple enclosed domestic cases have emerged, stoking universal fears of an imminent, uncontrolled spread countrywide, right as the most cherished Chinese Lunar New Year homecomings approach. Experts are voicing grave dismay that this newly emerged, highly contagious mutation could relentlessly dominate the upcoming winter months, just as population antibody defenses grow increasingly depleted, enabling JN1 to inflict serious, widespread health repercussions on China's hundreds of millions of vulnerable citizens. JN1's sudden ascendancy and infiltration globally induced the desperate World Health Organization to quickly designate it as a prominent variant of interest last month, given its rapidly snowballing international reach. Harboring over 30 unique mutations distinguishing it from even recent variants, apprehensive scientists believe the enigmatic JN1 may drive markedly more severe symptoms and elongated recovery periods compared to past strains. With JN1 case counts continuously mounting at alarming, unprecedented rates, experts almost unanimously agree that the repeatedly shape-shifting novel coronavirus seems unlikely to dissipate anytime soon, compelling increasingly urgent countermeasures from health authorities. Chinese officials emphasize the paramount importance of staying extraordinarily vigilant and proactive against ever-evolving viral variants like the dangerous JN1 that pose grave existential threats for public health and safety. They caution that previously unthinkable restrictions may return if this troubling new variant continues spreading uncontrolled. As distressed citizens across China voicing soaring fears of yet another holiday season tainted by the ongoing pandemic that halted their world 3 years ago, many feel psychologically defeated at the prospect of again battling an invisible, ever-adaptable foe they hoped had finally faded into the past. China's new COVID-19 variant JN1 spreads rapidly, overwhelming hospitals. A dangerous new COVID-19 variant dubbed JN1 is raging through China and spreading globally. This new mutation is spurring a viral resurgence, catching the infected nation and World Health authorities off guard. In China's Hunan province, hospitals and clinics are inundated beyond capacity by crowds of JN1 patients presenting with severe symptoms and new cardiovascular complications. Locals describe scenes of agony and despair, with treatment proving ineffective for many. Numerous accounts point to poor longer-term outcomes. A 16-year-old girl from Hubei province passed away just 1 day after developing a fever. Despite ICU care, she tragically died within 4 days of admission. Beyond the immense suffering, Chinese authorities refuse to release transparent epidemic data, obstructing international tracking efforts. However, leaked information paints a dire picture. In the city of Hengyang, resident Peng reports symptoms identical to previous waves. Moreover, 2 workplace colleagues died suddenly this fall, one seemingly from a heart attack. Such stories are now commonplace, as JN1 attacks the body in new ways. The deceptive JN1 variant also spreads with unprecedented ferocity. Extending beyond China's borders, over 400 cases erupted in India, alongside 6 deaths in mere days. Malaysia suffered a 60% single-week spike, exceeding 20,000 new cases from December 10 to 16 alone. Experts reveal that JN1 spreads up to 8 times quicker than the earlier XBB strain. Furthermore, it displays substantially strengthened immune evasion, rendering all existing vaccines powerless against the shape-shifting virus. China itself detected JN1 in October, though officials later backtracked. New claims oddly cite first discovery in November and just 7 total cases by December 10th. Based on the discrepancies and denial of realities on the ground, Analysts accuse China of lying about JN1's emergence. They believe China seeks to deflect responsibility for the mounting global woes seeded by its new viral offspring. Funeral homes overwhelmed amid outbreak, bus rider death censored. As COVID-19 resurges across China, citizens describe crematoriums and funeral halls filled beyond capacity. Multiple residents relayed seeing mourning facilities so overloaded that grieving families must now travel to distant locations to find an open venue. Long queue waiting at a crematorium in China. Crematorium is so crowded that many Chinese have to wait till evening. Some said their turn may be at dawn. College employee Chen Xin, alias, shared over half his workplace, has fallen ill amid the fresh viral wave. Elderly make up a significant portion of new casualties. When recently attending a memorial for a deceased friend, Chen found the closest crematorium already filled with more bodies than normal. The mourning hall itself had no rooms left to receive visitors. In another chilling incident evidencing the outbreak's severity, a woman suddenly collapsed and died aboard a crowded bus after rushing to board. Though dozens gathered around the tragic scene, authorities swiftly stepped in to bar any reporting on the incident by witnesses present. Citizens widely suspect infections from Omicron subvariants based on recognizable coronavirus symptoms: fevers, headaches, loss of taste and smell. But hospitals continue refusing COVID tests for patients while disguising case numbers under generic diagnoses like influenza. Meanwhile, an eerie silence pervades official state media amid the health crisis, while heavy censorship bars open discussion online. Experts warn chronic underreporting enables viral mutations that may only worsen future outcomes. As China moves to live with the virus but suppresses the human toll, the truth of outcomes in Chongqing signals the true depth of risk the country faces entering 2023, if denying the COVID resurgence. China faces accusations of deceit and buck passing as Omicron subvariant JN1 fuels COVID-19 surge. As a new COVID-19 wave fueled by variants sweeps China and spreads overseas, the Chinese Communist Party has altered its messaging, provoking accusations of passing the buck. Hospitals and clinics in many parts of Hunan province are overwhelmed with patients suffering prolonged illnesses that transform into critical cases of white lung or even sudden death, according to residents. However, officials are not publishing data. There's lots of coughing, lots of sick kids, and in the winter this new coronavirus causes a lot of cardiovascular disease. In our village, a couple people just suddenly collapsed and died, said Wang, a resident of Zhangzhou village. Peng, a resident of Hengyang City, told this outlet his symptoms resemble the wave after prevention measures were lifted last December. This year, 2 colleagues in his workplace died suddenly in the second half. Multiple countries have now detected cases of the new Omicron subvariant JN1, which experts say spreads up to 8 times faster than previous strains and evades immunity even more. Recent vaccines offer little protection. JN1 has gone beyond expectations, said European virologist and infectious disease expert Dong Yuhong. It's basically a new virus redamaging the human immune system, a more severe form of immune escape. China claimed to first detect JN1 in October but recently backtracked to say discovery occurred in November with just 7 cases so far. Experts accuse China of deceit and preparing to shift blame overseas. You can see the CCP getting ready to pass the buck, said Li Yuanhua, former associate professor at Beijing Normal University. The contrast between Chinese and foreign data shows the CCP is lying again. The Epoch Times recently reported at least 4 Chinese Academy members and 19 renowned professors died in the first half of December 2023. At least 10 were CCP members and 4 were under 55. Meanwhile, at least 10 controlling shareholders of China's listed companies have died of illness or sudden disease this year, some as young as 50. Slaughterhouse situation unfolding in Shanghai hospital as patients perish with strange smells. Troubling stories have come out of a packed Shanghai hospital with weird happenings and patients dying unexpectedly left and right. People are saying stomach-churning smells started filling up the wards, coming from certain critically sick patients not long before they kicked the bucket. These smells have been described as straight-up rotten, like decaying flesh. While the exact hospital hasn't been named, the severe overcrowding makes it sound like one of Shanghai's huge hospitals that's been flooded with hordes of the city's ill residents. From some of the social media footage leaked, patients are lined up elbow to elbow in hallways just hoping to be seen. With doctors and nurses working round the clock, overwhelmed by the endless waves coming at them, some locals have quietly suggested that nasty hospital bugs have been passing unchecked between the burnt-out medical staff and into the people they're meant to be treating. Which begs the question, what could be going on there to cause dying patients to stink like this? Now, people are asking whether higher-ups are covering up the real story behind these deaths. With no official explanation given about how they died, skepticism is growing about vital info being intentionally hidden from public view. This climate of distrust about Shanghai healthcare is destroying confidence in the system. If ambitious investigators keep getting slapped down and gagged for poking their nose into this business, the chances are slim we'll ever understand how hazardous this hospital has turned. That foul reek may have already infected far beyond the poor wards it came from. As Shanghai citizens anxiously keep track of updates, plenty are wondering whether authorities could stop this thing if a wider outbreak is already long past the point of no return. Another pandemic hit China, signaling a potential food shortage. As China struggles to contain the ongoing COVID-19 pandemic, authorities now face the additional challenge of an apparently worsening African swine fever, ASF, epidemic, suspected to have spread across 18 provinces. The swelling ASF crisis has raised alarms within China's livestock industry as it grapples with the dual outbreaks. Described by officials as an extremely severe situation, the epidemic threatens to amplify the turmoil and economic damages already inflicted by COVID-19 countermeasures and restrictions. An internal Livestock Association document from December 15th reports increasing ASF cases concentrated in northern provinces. Sporadic infections in other regions highlight the disease's uncontained spread. Experts cite a highly transmissible variant virus, strains with subtle symptoms as key factors stifling eradication efforts. With no indications the outbreak is slowing as winter temps set in, officials have labeled ASF a formidable adversary, as dangerous as COVID-19. The possibility of further expansion has bred sizable concern over deepening impacts to public health and livelihoods. The first ASF case emerged in 2018, eventually triggering a 40% decline in China's pig population by August 2019 and 1 trillion yuan in economic losses. Now, alongside COVID-19, authorities must combat ASF outbreak clusters in 18 provinces and growing. Among China's largest pig farming provinces, Sichuan issued emergency protocols to avoid potential calamity, banning the transfer of pigs over 30 kilos from outside its borders. Other major agricultural regions have enacted similar shipping restrictions out of caution. This might signal an upcoming food shortage since diseased pigs cannot be consumed. The African swine flu on top of COVID is another massive blow to China's already dire situation. Furthermore, the pandemic is getting worse and worse every day in mainland China. China finds itself in the grip of a dire triple threat: the relentless JN1 Omicron variant, a spiraling African swine fever epidemic, and a government who conceals the true scale of these crises. Hospitals are overwhelmed, citizens burdened by staggering medical costs, and funeral homes stretched beyond capacity. The situation resembles a dystopian nightmare. As the world usher in 2023, the critical need for transparency, effective crisis management, and international collaboration becomes glaringly apparent. The world watches, recognizing that the profound risks extend beyond immediate health concerns, impacting the very foundations of Chinese society.